Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Auto insurance can all seem the same until it comes time to use it. So don't get stuck paying more for less coverage. Switch to USAA Auto Insurance and you could start saving money in no time. Get a quote today. Restrictions apply.
USAA. Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
How is a private eye? Like the dry cleaners? They both do other people's dirty work. I was going to tell you a dirty joke, but I don't want you to soil yourself.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, massage therapist, or whatever. Don't forget to check out Dr. Scott's website at simplyherbals.net, simplyherbals.net, and we'll talk about it in just a second. Check out stuff.drsteve.com, stuff, stuff.drsteve.com for all of your Amazon needs. You just click right through to go to Amazon, or you can scroll down, see all the stuff we talk about on this show, including the Neuralgia, and it's that time of year.
Oh, yeah.
I've had a bunch of people who have tried it that have emailed me saying this is the greatest thing I've ever bought. So I'm just, we have no financial relationship with them whatsoever. It's just cool as hell. But if you scroll down and go to stuff.drsteve.com, buy it from there, man, it helps us out a little bit.
There you go.
And check out Dr. Scott's website at simplyherbals.net. That's simplyherballs.net. And I said that already. And then patreon.com/weirdmedicine. Tacey and I are doing a thing now called the Exam Room, where we have celebrities in, and they ask us questions. And it's sort of an inverse interview, and we get some stuff out of them, too. And it's loads of fun. It's inexpensive. And there's a bunch of different tiers, including a $20 tier, which I'm not pushing it. But if you're really a weirdo, you can well, I shouldn't call you that, but you can, pledge $20. You get full access to our Dropbox that has every show that's ever been aired on it and some special material in there. You can just download all that crap and then just downgrade or just cancel altogether. It's whatever you want to do. So check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And you were having some technical difficulties, but now it's working, at least with one person.
We think so. Yeah.
I think it was just one person.
I doubt it. I don't.
Oh.
Yeah, well, I mean, you know as well.
And you know what people will do is if they go to order something, they'll say, I'll throw Dr. Scott a couple of bucks.
Yeah.
And then they go in there and they can't put anything in their shopping cart and they can't check out. They just go, oh, fuck.
Yeah, it makes me look like a big doofus.
Well, they just say forget it and they just move on to something else. I know. I've done that a million times.
Yeah, and I don't blame it. And I apologize. We try to stay on top of it. And to be honest with you, I doubt if it's just the one person because he's an IT guy. He's a very smart guy. You could tell he's a super guy.
It could be browser dependent or something. So.
It could be.
Listen how smart I sound. It could be your browser alarm.
It could be my doofus website too. So, but we think it's working now. So
all right. Okay.
Keep fingers crossed.
Could be that RSS feed there, Dr. Scott. You never do know. Anyway, you're. By the way, I do want to say this, and this is not a commercial for Dr. Scott because we're not really allowed to do those kinds of things on here. But let me tell you something. That damn peppermint nasal spray with the CBD in it, that stuff's the bomb.
It's good stuff, isn't it? Yeah.
It is good. Now, if I had any complaint about it whatsoever, and this is extremely minor, on your next iteration,
Sure.
If they could get the spray bottle so that you get a little bit more nose feel when you do it. I don't know how to explain it. There are certain nasal sprays you spray up there, and it feels like the mist is, penetrating your brain almost.
Okay.
And I'm not getting as much, particularly given that you've got peppermint oil in there. I don't get as much of that. Although it's extremely effective. I like it a lot. It would be absolutely the greatest thing in the world if they just handled maybe just a little more volume.
Maybe.
And the thing is, people would use it up quicker and you'd be selling more. So that's a win-win for everybody.
Yeah, I will tell you this: that peppermint oil, a little too much can be really
so you run down
we'll
go down a couple % on the dilution maybe.
We could. Yeah, we sure could.
But
any criticism?
It's not a criticism.
No, that's what I was going to say. No, I apologize. No, any kind of constructive advice.
It's not constructive advice.
It's not even. It's not nothing. It's just.
I want
nothing.
more. I'm just filling time on a radio show.
But thank you. We're very proud of you, and I've had wonderful
good
feedback.
Anyway, okay, we got to be careful.
Anyway, we're not talking about.
Check out Dr. Scott's website, simplyherbals.net, and check us out at drsteve.com, the eponymously named website. All right. I have a news story that was sent to us from Mike from New York. And it's like, Dr. Scott, what the F is wrong with you that you didn't find this?
Uh-oh.
But this is from that prestigious medical journal, the New York Post. And it's, the headline is, and they never have clickbait titles, headlines. I suffered a scary sexually transmitted allergic reaction to nuts. Okay, so there you go. All right. And then, here's how it starts. Nuts. Come on. If you're going to... It's not journalism. Pharmacy staff couldn't keep it together after an OnlyFans star needed treatment. They couldn't just say a woman. It's got OnlyFans star needed treatment for an extreme allergic reaction to peanuts that was induced by her partner's ejaculation. The Daily Mail reported. Okay, so they're reporting from something that somebody else reported on. Also, really, it's excellent. The adult video heartthrob, known as Australia's sultry dressing and peanut allergic Lucy Banks, spoke out on the rare phenomena that caused her intimacy to become ire and left her desperately waddling to the drugstore for help. And the waddling was in quotes. I never heard of food allergens transmitting and negatively affecting partners through ejaculation before, Banks told the Mail, probably in her extensive, Rhodes Scholarship research. But I'm just being an asshole. Most of us hadn't heard of this either, so to be fair to her, I'm being an asshole. Mentioning her stud of the hour had eaten peanuts earlier in the day. Now, if you've eaten peanuts and then you make out with somebody, you nasty, because peanut breath's the grossest thing. I'd rather French kiss somebody that's just eaten a cigarette, they smoke half of it and then eat it. Then kiss somebody that's just eaten peanuts. There's something disgusting about it to me. Anyway, he had eaten peanuts earlier in the day and inadvertently transferred them to her during sexy time. Despite the severity of Banks' phallic-caused anaphylaxis, the pharmaceutical staff was in hysterics upon the improbable diagnosis of her anguish. Okay, that's first rule is you don't make somebody sorry for coming to see you if you're a medical person.
No, or make
and
fun.
we've tried to do that on this show too, although we haven't exactly succeeded. But we try not to make anybody sorry that they called us.
No.
You know, and when someone comes in, if they have they've carved a squash, zucchini into a phallus and got it stuck up their ass. You don't laugh about it. You might laugh about it later.
Yeah.
There was that video of those people removing something from somebody's something. Do you remember that? There was something that was caught in someone's. I know. I just remember there were a bunch of people in the operating room and they were pulling something out of this person's vagina, I think, and they had to do it under anesthesia.
Oh no.
And they were all just laughing and whooping it up, and it's like, that's not cool.
That's not cool.
There's nothing cool about that.
No. You know, I was thinking about the stories that we read. It's been a couple of years, but the guys trying to measure the length of their penises by shoving those damn electric cords up their urethra.
Oh, they were uterine sounding.
Yeah.
I mean, urethral sounding.
Is that what it was?
Yeah.
Oh, I thought it was measuring something.
Well, that's what it's called.
Oh, is it what's called?
So
Okay,
sounding, like if you're sounding in the ocean,
okay. Gotcha.
So sounding is when you stick something in your urethra.
Gotcha.
And most of the time we will do that to measure the depth. We really wouldn't ever do that, but I'm just trying to think, why would we do that?
No.
We actually wouldn't do that.
No.
Maybe urologists do it.
Yeah.
But
to torture people.
But you can take a little metal thing and you can do some urethral sounding just to see how deep it is, I guess. But we need to find out, why do urologists do that? We need a urologist that we can call.
Oh, I've got one. You and I both have one on speed dial.
Oh yeah, we do. You want to call him?
You know what? He's probably taking a nap. He is retired.
Okay. Okay, urethral sounding is the insertion of an object or liquid into the urethra. Sounding may be used in urologic surgery for dilation of strictures or for obtaining access to the bladder. Urethral sounding is also performed outside the scope of medical practice by individuals for a variety of reasons, mostly just goofing around is what it is. And some people will derive sexual pleasure from that. But my understanding is that sounding, the definition of the word sounding was to measure. Let me see. Definition of sounding. I thought that you were, using an instrument to drop it into something else to measure it.
Okay.
Yeah, okay. Yes, the action or process of measuring the depth of the sea or other body of water. Okay, so normally... So what they're talking about is just urethral dilation. That's not really sounding. But anyway, I'm being overly technical about sticking something in your cock hole.
Yes, because that really hurts.
And so, so what were you talking about? So I interrupted you. They were taking some wires and sticking it in their cock hole for what purpose?
Oh, I don't know. Remember, we had that was one of our stories a couple of years ago, but the guys
they
were
let
trying
go
to measure.
of them?
Yeah, they're trying to measure the length of the penis by using like the phone chargers. Okay. Remember the guy had that Apple thing? It was like the whole thing was stuck in his bladder.
Yes. He let go of it.
Yeah,
it was curled up in his bladder. If you're, I can't recommend that anything be stuck in the urethra. Really, nothing is designed to be stuck into that. That's why if you ever had an STD test, they stick that swab up there, and it has to stay there for 10 seconds, and it's the longest 10 seconds of your life.
Oh, my God.
And then if they twirl it, it hurts so bad. And then Dr. Scott and I both had fiber optic fiber optic scope of our urethra and bladder, and that sucked. Even though they lubed it up and put quote unquote numbing gel on it.
And spoke sweet to us. And,
yeah.
You know, the music was nice.
Speaking of, did I ever tell you about the time that I had a chalazion, which is basically a cyst caused by a sty, but inflammatory cyst in my eyelid, and I was going to have it removed.
Okay.
And the guy that did it is retired, and I'm not going to say his name.
Okay.
But I had rotated with him, so he knew me. And I'd been in that practice 1,000 times, you know, when I did my ophthalmology rotation, all this stuff, and I knew all of them. Well, luck of the draw, pulled him, and he just liked doing cataracts and stuff. That's all he liked to do. But so he agreed to do this. Take the cyst out. So to do it, they have to flip your eye upside down. If you go to our YouTube channel right now, it's on there.
Okay.
You know, different guy. Okay, the guy that's doing it here is not this guy. And but they invert your eyelid, and then numb it with a needle, and then slit it, and then dig the inflammatory cyst out. Right? And then they unflip it again, and then it heals up on its own. You're bleeding under your eyeball and all this.
Is it like a granulated cyst?
Yes, yeah.
Okay.
But it's defined. It's well defined.
Right on.
And you can just scoop it out.
Okay, good.
With a curette. So anyway, this guy, and I don't know what the hell bug got up his ass, but I had my archery book that I had just co-written with this guy. Well, I ghost wrote it. And I had, you know, the galleys in my lap, right? And I was sitting there reading while I was waiting for him to come in. And so he kind of lays me back. And when someone inverts your eyelid and sticks a fucking needle in it, you're going to grip.
Yes, something.
You're going to, you're going to grip the sides of the chair.
Right.
That's it. That's all I did. I just gripped the side of the chair because it's a reflex. And he starts talking to me like I am literally like 3 years old. He started going, "Are you the archer? Are you the big archer?" Yes.
Oh.
Yes, you're the big archer. And I'm like,
oh, no.
Dude, I'm 40 years old.
Oh, no.
Why are you talking to me like this? I never went back. It skeeved me out so bad.
Oh, my.
So anyway. All right. Where were we?
That is... Who knows? But that was a good story.
Urethral sound.
But yes, urethral sound. Yes, Sean was saying that that he's had a couple of those procedures, and he goes that numbing gel does nothing.
No, it makes them feel better.
It does. Yep.
It literally just makes them feel better. Oh, I'm doing something to, you know, anyway. It doesn't make us feel any better. No. By the way, urologists listening to this, and I know there are a couple. Do something different. Now, this is what I would do. If I were practicing urology, and I don't even know if this would work, but I would fill up a syringe, like a 10 cc syringe, and not put a needle on the end of it, just, you know, with the tapered, like a lure lock or something, and just jam that into the urethral meatus and fill it, well, obviously, fill it up with lidocaine gel first, numbing gel, and squirt it into the urethra and let it fill up the urethra and then let it sit for a couple of minutes and then do the fiber optic. Just putting the stuff on the end
does nothing.
Of the scope and then jamming it in there does absolutely nothing. I know we've talked about this before. Dr. Scott and I were very traumatized by this. We're still traumatized by it. Good Lord.
Oh, my gosh. Yeah.
That's not to say if you need it, don't do it. Yeah. Just do it.
It is. But it's worth it, but God, it's horrible.
Yeah. The way it was done to us kind of was sucky.
Yeah, I would even say what we need is a big old glass full of lidocaine to just hang your junk into for a little bit, just to kind of numb the whole thing.
Yeah, just numb everything.
Maybe ice bath of lidocaine.
Now, here we go. The pharmacy worker, we're back on this Lucy Banks again, who is extremely attractive, by the way, called over a few colleagues and tried to ask their opinions and help, but she couldn't stop laughing. This is... when I say it's bullshit, I'm not saying she's lying. I'm saying That sucks. It's just not okay. I know it's ridiculous, but she's having an allergic reaction to peanuts that could be life-threatening, and they're just, he ate peanuts and then he ejaculated into her, and now she's,
Not so funny.
That's
Not funny at
no.
all.
She is very attractive. I would never laugh at her.
Now, what's her name?
Lucy Banks. Check her out.
Yeah.
She makes $60,000 a month, according to the Mail, is now preaching a PSA to warn others about the dangers of sexually transmitted food allergies, especially from a peanut-loaded penis. Now, I like that. That's alliterative. If you have severe anaphylactic reactions to certain foods, I would take special precautions with your partner. Make sure they haven't eaten anything. This is actually true. That could trigger a negative and possibly serious response if they've got it on their mouth. Some of these peanut allergies are so sensitive that if you ate something with peanuts and then kissed somebody, they could have an allergic reaction.
Yeah.
So she's right about that.
Yeah, she is, yep. Poor
she's
thing.
right about a lot of things, in my opinion. She also posted her warning to TikTok, of course, which was taken down by the platform after getting more than 4 million views. How are you supposed to monetize anything on TikTok except getting millions of views?
Exactly.
Good God. And then listen to this journalism. Similar to Banks's big bust, the Department of Immunology at St. Helier had studied the effects of allergies caused by sex. It doesn't even make sense. They just want to throw in that she's well endowed in the breasticle department. They profiled a woman who came to an intense allergic reaction from a handful of Brazil nuts that were eaten by her partner before the two got busy.
Ugh.
Okay. And just go watch the Louis C.K. episode about Brazil nuts. That's all I'm saying. All right. Very good. So there you go. So we may save a life with this.
Yep.
When I first started reading it, I was kind of, tittering as well. But this is actually a real thing, and it actually can have serious consequences for some people. The whole peanut allergy thing, there's some people who are like, it's bullshit. It's for the people who have it, it's not bullshit.
No, God, no.
One of my best friend's kid had multiple food allergies, and they would routinely come home when he was little and find him on the floor blue, gasping for air, and they'd have to give him epinephrine and stuff because he had, rubbed against a place where some peas had been spilled and they weren't cleaned up all the way. I mean, it was crazy. That's a real deal. So, all right, okay, what do you got?
Well, that's the funny thing is I just found this on the news before I came in here. It was talking about how STDs are on the rise again.
Excellent. Again, because people are having intercourse again. They're hooking up.
Yeah, some people.
Is that what it is?
Yeah.
Some people, not me, of course.
And the COVID was a big driver. So of course it went up during COVID because everybody was stuck in.
Wait, STDs went up during COVID?
Yeah, and they continue. They're continuing to rise. Yeah, they said there's 2.5 million cases right now of chlamydia, gonorrhea, syphilis.
That doesn't make you a bad person.
No, but hey, but the problem is you're going to probably have to get that damn cotton swab stuck in your.
Oh yeah.
Urethral meatus, and that's not going to feel so good.
Not feels good.
So cover it up.
Wait a minute now. Why did it go up during COVID? I would have thought it would go down during COVID because everybody told me that they weren't hooking up randomly anymore because of COVID. They were afraid of catching something.
I think that was in certain age groups. Now I'll do some more digging. But
God damn it, Doctor.
No, I'm telling you, it's what I read. I'm not telling you it's the God's honest truth. What I'm telling you is I read that. But here's the thing: a spike in STDs.
I'm looking at the CDC. Go ahead.
It just talks about how that 16 to 24-year-olds.
New CDC data. This is showed during March to April of 2020. That was when the lockdowns happened.
Yeah.
STD cases dramatically decreased compared to the same time in 2019.
Uh-oh.
Wait. Now, you may have an out here because you could say, ooh, this is what I really meant. However, a resurgence in gonorrhea and syphilis cases later in the year suggests overall STDs may have increased during 2020.
Ooh.
All right, so I'll give you that. As of December 12th, this is July 16, 2021, is when this chlamydia 14% lower, gonorrhea 7% higher. That's weird. Primary and secondary syphilis 1% lower.
Isn't that wild?
Not interesting. Yeah. Okay. So, but now they're continuing to rise because people are using Tinder and stuff again.
Yep.
Is that what you're saying?
Yep.
Okay.
Yeah, and it's driving the 16 to 24-year-olds primarily.
Really?
Yeah.
So you're saying sex is bad?
Sex is bad.
Jesus.
I don't know what I'm saying anymore.
You got anything else? Oh, this guy attacked. Attacked is a strong word. It's Mark. I'll just say his name is Mark. It says, please read this clinical guide to testosterone replacement therapy. Your knowledge of TRT is inaccurate and outdated. So what he sent me was a link to this place. I don't want to say the name of it, but it was some place that, sells male health, sort of. It's hard to explain. But listen, there's a lot of views on this. I go by the clinical guidelines that are set up by our governing bodies, and those are based on evidence and best evidence. Now, could I be behind on my HCG? Because I kind of poo-pooed HCG a little bit, and this place really pushes the HCG. So let me just read to you from an article, Human Chorionic Gonadotropin, that's HCG, monotherapy for the treatment of hypogonadal symptoms in men with total testosterone greater than 300 nanograms per deciliter. So that's interesting. So these are people who are having symptoms, but their doctors go, oh, you're normal. So these are the low normal people. Mm-hmm. And they're saying, deficiency recommends that 300 nanogram per deciliter be used as a threshold for prescribing testosterone. We've talked about why that's a fallacy. If you have low normal testosterone but you're symptomatic, your doctor needs to treat you, whether it's Clomid, and he says, oh, I'm way behind. You don't understand Clomid. Dude, we were pushing Clomid when nobody was using Clomid. Yep. And most of my colleagues don't know anything about clomiphene citrate. Right. And basically what that is without going into the mechanism, it helps the lazy testicle produce its own testosterone. So you don't get shrinkage of the testicle and you don't lose fertility.
You can remain fertile.
Right. Unlike when you take testosterone therapy. So I don't know where I'm behind in all of this. But anyway, it says it's not uncommon for men to present with signs and symptoms of testosterone deficiency despite having testosterone levels greater than 300. Okay, fair enough. We've talked about that really since day one of this show. Mm-hmm. There exists scant literature regarding the use of HCG for the treatment of hypogonadism, in men not interested in fertility. So that's why there are some studies. And because there are some studies, there are places that will open up and say, well, this is what we do, cutting edge, and we're going to give everybody HCG or certain people HCG. And I've talked to urologists about this, and I think our knowledge is reasonably up to date. I mean, listen, don't come to me for treatment of this. This is just a goofy radio show about medicine and weird dicks and nuts and stuff like that. Right. So, but as far as I know, with regard to clomiphene, we are ahead of the curve. And when it comes to testosterone replacement therapy, we're actually ahead of the curve as well compared to a lot of primary care docs that go, well, if it says normal next to the number, we're not going to treat it. And that's bullshit.
That's bullshit.
And I've had people email me, and I send them an article to take to their doctor that says treating symptomatic people that have classic symptoms of hypogonadism, right, fatigue, erectile dysfunction, loss of libido, physical weakness, But they have low normal testosterone that they improve if you treat them.
Yep.
And that a 6-month trial of treatment is worth doing in those
Absolutely.
people.
Yep.
So, dude, I mean, I appreciate it.
Yep.
And I appreciate the business. Your understanding of HCG and clomid use is outdated. I don't think so. I don't think so pretty up to date on the literature. Now, could I have missed something?
Sure.
Absolutely. And I like to be demonstrated to have incomplete knowledge.
Mm-hmm.
I'm
Me
not
too.
like
Me
that.
too. No, I know you are. Yeah.
I like that because if that's true, then that means I learned something.
Yep.
So I
Builds
like
to
learning something. So if you've got literature from peer-reviewed literature, not something from some commercial website, because dude, anybody can write anything they want.
Sure.
We have clinics in this town that still advertise HCG for weight loss.
Yep.
And study after study after study shows that it's not the HCG that causes people to lose weight. It's the 600-calorie diet, starvation diet that they put people on along with it.
Yep. Yeah, I know, it's crazy.
So there have been multiple studies looking at doing the diet alone or doing the diet with HCG. There's no difference. Yeah. So, but they sell it, and they can legally do it.
Oh, yeah. Yeah.
They'll
sell it to somebody to buy it.
Yeah. I mean, and it's legal.
Yeah.
So this place is legal to do what they're doing as long as if they're going to prescribe a scheduled drug, which testosterone is, that they follow the rules of their state for prescribing scheduled drugs, and then they're fine. But, bro, I don't know what you're talking about. I really don't. So feel free to educate me on this stuff. If you found something interesting, I'm always happy to look at it. But anyway.
Agreed.
All right. No, you're outdated. No, I'm just kidding. Mark, I'm just kidding. It's a radio show. I'm just dicking around.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
I cannot find my YouTube. Are we still okay on there?
Yeah, you're on.
Okay.
Yeah, we're rolling.
All right,
We got a good crew today.
Okay,
buddy.
you got any questions from in there?
We had one earlier. They're all talking.
I see
about
Cardiff Electric is he is the owner of the network that we're on, the Cardiff Electric podcast.
No, I have not seen a question.
No, I just know that he's there.
Yeah, he
we
is
actually
there.
have a question from him today.
Oh, cool. Well, let's do it.
No, I mean I have a voicemail from him.
Oh, cool.
Yeah. All right. Do you want me to do it, or are you doing something?
No, do it.
Oh,
yeah.
Okay. All right. Let's see here.
I'm going back in time.
Okay.
Hello, Dr. Steve. How are you?
I'm fine. How are you?
I have a medical question for you.
Okay.
So, earlier today, I was practicing my machete work, and I accidentally struck myself in the upper thigh. It is bleeding rather profusely. I was just wondering what you think I should do. I will hang up and listen for your answer.
Mm-hmm.
Thank you.
Thank you, sir. and thank you for your service to our podcast community. So I think what he's doing is illustrating how ridiculous it is for people to call us with urgent needs. If you have an urgent need, don't call us. He may have left that voicemail 2 weeks ago.
Uh-oh. He's probably in trouble.
I'm waiting for Dr. Steve.
We do our best to answer everything as promptly as we can.
So go to the ER.
I
am hoping that Mr. Cardiff will show up at the WATP live event. I don't mind plugging this for Carl at all because I'm going to be there. It's March 14th, 15th, and 16th. Go to WATPlive.com to get tickets. And if you come and say howdy do, I'll buy you a beer if you're allowed to drink. And if not, hearty handshake.
Yes.
All right? And my T-shirt is going to make people shit their pants. I'm just telling you right now. I created it last night. They guaranteed that they'll be here in time. I made 2 mediums, 2 large, and 1 2XL for Vinny Paulino. So
there you go.
All right. Okie doke. Let's see. Somebody asked, is it okay to eat gold? Gold is pretty non-reactive. Yeah. Silver, no. Silver, particularly silver salts, are not okay to eat because you will get a thing. Do you know the name of it?
The blue man disease.
Yeah, it's gone. Right. I'm not going to give you a bell for that. It's Argeria.
Oh, it's Argeria. No, I'm sorry. I was thinking about, speaking of gold, what is that drink? Goldschlager.
Oh, yeah.
It has gold.
Yes, it does.
In it.
Is that really gold in there?
I don't know, but it'll make you.
Look that up. Is that actually gold in there? Because gold's worth about $3,000 an ounce or some shit like that. I can't imagine they're actually putting gold in there. But if it's not gold, what the hell is it?
I don't know. I think we drank a little bit too much of it one night.
Oh, no, dude. Then I didn't know you were like that.
It's only one time.
Ugh.
Well, that's because you're an idiot.
That is true.
Well, seriously, I found a little airplane thing of Goldschlager in the. I'd never had it before. I said, well, I'll throw that in with some tonic. Oh, that's that a mistake. Was it taste like peppermint or something?
Yeah.
It's awful.
It's terrible.
It's not good, in my opinion.
I think we found it in Grandma's,
it's a little
cabinet. We just drank it because we're stupid.
So
kids.
what does Goldschlager have actual gold in it? Gold leaf or
very
something?
thin yet visible flakes of gold floating in it. The actual amount of gold has been measured to be approximately 13 micrograms.
Okay.
Yeah.
So an ounce is, let me see, an ounce, is 30. I can't remember in weight though. 1 ounce of gold in grams.
Here you go. I've got it.
Oh, you got it? It's 28 grams. So an ounce of gold is worth 2,068 right now. So how much? How many milligrams is it?
23.
This is fascinating.
Yeah, no.
We'll figure it out.
Yeah, we'll do it later.
Anyway,
I'll worry on the next subject.
Maybe we'll do it on the podcast. Okie doke. Yeah. So it would seem like Goldschlager would get more and more expensive at some point. Hoarding Goldschlager and mining it for its gold would become profitable.
I think you're gonna have to drink a lot of it or pour it out.
So if you drink silver salts, which some people do, you can develop Argeria, and it's a rare skin condition that happens if silver builds up in your body over a long time. It turns your eyes, skin, internal organs, your nails, and your gums blue-gray. Go ahead and Google image that one. I'll tell you when you shouldn't Google image something. Tonsillar myiasis being one of those. Do not. It's MYISIS.
Don't do it.
Do not Google image that. No. But Argeria, do that, and you'll be blown away by these people, and it's always in areas of your body exposed to sunlight. So it's actually just like film. The film has silver particles in it as well, silver salts. And when light hits it, it changes its conformation, and it reflects light differently. That's what makes a photograph. And when basically the silver that's embedded in your skin is basically being developed or exposed by the sun, and it changes its conformation, it changes the color of your skin.
bizarre.
It's permanent, by the way. It's permanent. Now, let's see. Eating gold. I've not ever heard of any issues with eating gold. It's a noble metal. It doesn't react inside human bodies. So there's no gold, easily created gold salts, and therefore it's safe to eat.
Okay.
Don't. It's expensive.
Yeah, don't.
Silly.
Yeah, don't do it.
Don't eat gold. Unless you're just, But now they will take gold leaf and stuff and make cupcakes and cakes and stuff where they'll put gold leaf on it. And that's totally fine to eat.
I think I saw that show. The expensivest. It's the
expensivest.
The rapper 2 Chainz.
Okay.
He had like the world's most expensive joints, and they rode like with some gold leaf. It was hilarious.
Oh, that's cool. He's actually smoking gold.
He's a
gold
trip.
wrap joints.
He's a trip. Hey, so real quick, now somebody does have a good question. It's a starving dog. Listening to all the STD questions led me to a burning question. Is it give yourself a bill or a bell?
A bell.
And
Let's give yourself a bell. Here it is.
Yeah.
Give yourself a bill.
And DB.
It sounds like Bill, but
DB
it's
says it's an old oak.
It's Opie.
That's the F. She's right.
Matter of fact, so I did it on the old Opester. I had him on the exam room this weekend. It's on our Patreon, patreon.com/weirdmedicine. And I had Opie on there. Yeah. And I don't think he was expecting that. I did a couple other things to him, too. It was nice for once for me to be in control of the soundboard when he's on my show instead of the other way around. Mm-hmm. So, yeah, I needled the old Ope a couple of times, but we had a really cool conversation about some stuff too.
Yeah.
So check it out.
Yeah, cool.
Anyway, yeah, but it's give yourself a bell, and he used to say that, and I just grabbed it because it's so silly. Mm-hmm. And then I've done that on Anthony's show too. Opie and Anthony are not exactly friends anymore, and when I'm on Anthony's show, if he says something right,
give yourself a bill,
just to give him the skeevies.
Yeah, funny. Beautiful.
So there you go. Yeah. I love everybody. I'm friends with everybody. All right. Even this Mark guy with the testosterone thing, I'm friends with him too.
Why? Yeah.
All right. Okie doke. Let's see here. Thank you, Mr. Cardiff, for that question. To point out that this is not an emergency room. And check with your emergency room if you have an emergency. Okay, here's a good weird message.
Hey, Dr. Steve, it's Derek from Texas.
Hey,
I got
Derek.
a question for you. Why is it...
Wait a minute. This isn't Derek from Texas that was on the Howard Stern show. He's no longer with us. But he's still a Derek from Texas, though. I guess there's more than one.
Steve, it's Derek from Texas. I got a question for you.
Yeah, man.
Why is it when you fart, when you have those little silent farts, or
yeah,
those
like my
quiet
brother.
ones that stink so bad.
Yep.
And then when you have those loud farts, those big rip ones, they hardly have a smell. All right, thanks.
So you can't, listen, dude, you can't have everything. You're either going to stink people out of the room or you're going to make them laugh with a huge just noise. But you can't have it both ways. Now, my brother's silent farts, oh, my God.
Silent
it's the stuff of nightmares. And, most people can't remember smells. I mean, if you try to remember a smell, you can't. Mm-hmm. I absolutely can recreate. I do not have aphantasia or aphantasia of the smell. I wonder what that's called. Can't remembering smells.
Mm-hmm. Probably something along that line.
Well, aphantasia is not being able to remember sights. You have no mind's eye. Can't remember. Sorry, Carl. Smells. Let me see. Well, okay. Smell is the sense we're least able to describe. Okay. But it's the one that's hardwired into the brain, though. It's the first. Particularly in dogs, they have a really long ethmoid plate. That's where the sensory nerves for smell are. We still don't really completely understand how smell and taste work. I've always assumed that our ancestors used it to suss out food, and I'm talking about dog type or ancestors or ferret type ancestors.
Sure.
But you kept it to smell farts for one thing, because they're hilarious, but to determine if food is rotten.
Yeah, rancid, rotten.
And when you lose your sense of smell, it sucks because you can't tell. And that's the first thing I thought of is I can't tell if this is rotten or not.
And your taste goes pretty much too. Yeah, because your taste and your smell work together.
Yep.
In that regard, so it's really hard if you lose one.
Yeah, try tasting something if you hold your nose. You can get whether it's sweet or salty or sour, maybe, but that's about it. Yep. There's no resolution to it. All of that's done in these cells in this thing called the ethmoid plate. Well, anyway, so why was I talking about that? Just because my brother's farts my brother, yes, I can remember his farts. You may not be able to remember any other smell, but that I remember because it traumatized my youth. That son of a bitch used to hold me down. He's 12 years older than I am. And he'd hold me down and just fart in my face. And there's something is dead in his colon. It's always been that way. His Flatus smells so bad. And he has a good diet and stuff. I mean, he does probiotics and he eats a lot of green leafy vegetables and stuff. But I don't know what's wrong with him, but there's something wrong with him.
That is fun.
And I can't believe my wife doesn't remember the first time she met him.
I was surprised too because
But anyway,
yeah.
So those are his silent farts. I've never heard my brother actually have an audible fart. I know that he has had them because he told me about a time once when we were in Canada. He was dating a local girl, and the whole time they went to a drive-in to see a movie, and the whole time he was holding in all this Flatus, and that he was just blowing out the bottom of the John boat that he was driving, because we had to take a boat to get back to our house. There was no road.
Wow.
And it was just a little, skiff with a 5 horsepower motor on it. And he said that the Flatus that he was cutting, it resonated in the bottom of the boat because he's sitting on that seat that's in there.
Oh, my.
And it was louder than the motor. So anyway, so I know he has had them, but I've never heard one. Anyway, here's the answer to the question. Hydrogen sulfide causes the smell. Methane causes the sound. So you don't make that much hydrogen sulfide in your gut. You make a little bit, but it stinks to high heaven. But most of the giant farts that you have are either inhaled air, so it's nitrogen, oxygen, carbon dioxide, or you've got some bacterial colony that is producing the hell out of methane, which methane is pretty odorless. Okay? So when you have a huge volume of Flatus, when your colon is blown up by a balloon and you expel it all at once and you're through your anus and your ass cheeks flap together at and sound frequencies, that makes what we call a fart or Flatus. When it's at large volume like that, you're actually diluting out the hydrogen sulfide, if there's even any.
Right.
But you're diluting it out and you're expelling it away from your body, so it's dispersing faster. An SBD, however, could, and they can be odorless as well, but an SBD is going to be a smaller volume, and if you're producing hydrogen sulfide, it'll be at a greater concentration, and then it's just going to waft up to people's noses. It's not going to be explosively expelled out of your ass, and so you'll smell it more acutely. Does that make sense?
That's awesome.
All right. Let's see. Okay, this one is an important question, actually. We don't do those very often.
Yeah, question. I have the after effects of shingles to where your skin still burns. Do you recommend anything for that?
Yes.
It's been over a year now.
Oh, my God.
And it's still there, the itchy and a little burning. Thank you.
Oh, yeah. No, so I immediately texted him back. I said, you got to go see your doctor about this. What he has is, you want to say the words, Dr. Scott?
Post-herpetic neuralgia.
Give yourself a bill.
And yes, exactly right. It is post-herpetic neuralgia, so we all know that shingles is caused by a resurgence of chicken pox, but it usually comes out along one nerve root and a bunch of nerve endings, so it'll always be on one side of the body, causes chicken poxy looking things, pink raised papules with some blisters that will ulcerate, and then it heals up, painful and itchy. And if you don't take anything, there are some ways that you can try to prevent it. Some doctors will give a short course of steroids with a high dose of valacyclovir.
An antiviral.
Valtrex. Yeah, antiviral, thank you.
Yep.
And there is some decent data that will reduce the occurrence of the post-herpetic neuralgia. Because, if you get it on your side, it's just like you have sunburn, and not everybody gets it, but sometimes it'll last a week, sometimes a month, sometimes the rest of your life.
Yes.
But it could feel like a sunburn. It's just irritating. It's always there. And you can treat that. It's not that big of a deal. You can use lidocaine patches. You can use capsaicin, which is the hot stuff in hot sauce, and it seems counterintuitive, but you rub it on there and it burns you up the first couple of times, and then it depletes a thing called substance P. In other words, those pain fibers lose the ability to send pain signals to your brain anymore.
Right.
Or and there are other things that you can do. Gabapentin is a drug you can use. What do you guys use in traditional Chinese medicine?
And I was going to say the thing I suggest people is quickly get to somebody that does some acupuncture. We surround the lesions with acupuncture needles and
after they heal, though, right?
After they heal.
Or no, I'm asking.
I'll do them if they're still active. But typically, but typically I'll get them after they heal.
Yeah.
And I mean, I've got
because we try not to treat broken skin. But
but I don't go right to the broken skin. I go around it. Yeah, so I do almost like a nerve block at the spinal segment where it's going in. And but this is the acupuncture is one thing. With the electrical stimulation, I've seen work extremely well.
That makes sense to me.
With post-herpetic neuralgia, especially if it's been around for a long time.
Yeah,
because a lot of folks maybe they don't want to. Maybe they don't tolerate certain medications so well, but I would say get in to find somebody like me that can do it quickly.
Okay, so let me give you a better option, but this won't work for him. Go get the vaccine.
Oh yeah.
The vaccine has been demonstrated not only to decrease the incidence of post-herpetic neuralgia, but also just to decrease you ever getting the shingles at all.
Right.
Because let me tell you something. We're talking about post-herpetic neuralgia on your side, around your rib. You get shingles anywhere, and if you get it around your face, and you get shingles in your eye, and then you get post-herpetic neuralgia in your eye, that sucks, dude.
Yeah. I'm treating one right now.
That's why I've seen a couple of cases of that, and I mean the odds are that it won't happen there, but it's random. And that's a perfectly valid cranial or nerve bundle for this stupid virus to hang out in. And therefore, it could happen.
Sure.
I got the shingles vaccine just so I wouldn't get shingles in my eye.
Right on.
I ended up getting shingles anyway.
Yeah, and you can still get them.
Yeah,
breakthrough shingles,
but
normally
breakthrough COVID.
Exactly, but just usually it doesn't. It
lasted
linger.
2 days.
Right.
It was nothing.
Right on.
So I was very happy that I got it. I will say that the Shingrix vaccine kicked my ass.
You were sick. You were sick for about 3 days.
But I was worth it. It wasn't that bad. But it kicked my ass. I felt fatigued.
It's better than having a burning sensation.
Right.
For the rest of your life.
Yeah. Oh, you can get shingles in your taint, too. So don't think you can't.
Also, let's just say I've heard of cases of them
all
over.
Cletus, he got them taint shingles. He surely did. He didn't never walk a side.
Nope. Get him just about anywhere.
Shut up, Myrtle. Jesus.
Shut up, Myrtle.
Out of my head. Stupid asshole woman. All right. All right. So go get checked.
Yeah.
Hey, Dr. Steve. This is Daniel, and I live in Missouri. I was just wondering if you had any good resources on finding, like, a good primary care physician. I'm 33, and I've not really been to a doctor or had a primary care, and, since I was a kid, I guess. So, just old enough now that I probably need to get into one. So I'm just wondering if you knew how to find a good one, because, man, it just seems like they're hard to find. And I'd definitely like to find my Dr. Steve around here. So.
No, you don't.
Any resources?
Oh, damn. Yeah, you don't want to see me coming doing what I do.
You don't want him.
But, yeah, I know what you mean. You want somebody that is evidence-based, critical thinking that'll, drop an F-bomb
and listen
for fun.
to you.
But yes.
Yeah, and listen.
Oh, thank you.
Listen.
Yes, that's more important.
Listen.
So, someone who will listen to you, that will use some critical thinking, but won't be a pain in the ass to go to.
Mm-hmm.
It's one thing, and listen, Your specialists, they could be the biggest assholes in the world. You don't have to like your specialist. They need to be good. You need to like your primary care. You won't use them.
Agreed.
And you need to use them.
Agreed.
And their office staff needs to be attentive to your needs as well. And these offices where the providers are not paying attention to how the office staff is talking to the patients, that's a problem. Because I hear every word that my nurse says to my patients, because where I work is right just down the hall from where she is. And we work on scripting sometimes. Hey, if I've said this, it's more effective if I use it this way, that kind of stuff. But if you're not paying attention to that, they can become like civil servants and start really just chasing your patients away. So you got to have the whole thing. So let me tell you what to do. There, you can go to familydoctor.org and you can put in your zip code. It'll give you a list. And then if you've made some friends around there, and if you've moved or if you've lived there for a while, just ask them. Word of mouth is key. Yep. Not health grades. Don't go on to health grades, because I get on there and goof on some of my classmates sometime. So don't use health grades.
You would.
You would. And then if somebody gets a bad review, they hire people to go put 20 good reviews on there to mask it. So health grades no good, but your friends will tell you, hey, I like my doctor, I hate my doctor.
Yeah.
They suck, or they're really good, but their office staff sucks, or whatever. So
great.
Word of mouth is the way to go. So let's do another question. Let's try this one.
Hey, Dr. Steve, what's up? Just had a random question for you.
Yeah, that's what we like.
In regards to cancer, why can't we just do, once we hit 60, 65, why can't we just do, a preventative round of chemo? Just freaking kill anything that's, growing or whatever.
Yeah.
And, hope for the best. Thanks a lot.
No, I think it's a great idea. We're just not there. That's what you're talking about is Star Trek. Or Larry Niven's dicta immunity or something like that. The problem is that right now every chemotherapy regimen is, there are algorithms for them, but they have to be personalized.
Yeah. Some
people have kidney function trouble, so they got to reduce, or they don't tolerate it. Not everybody tolerates everything. There's this one chemotherapy that if you take it and you have a certain enzyme deficiency, it can almost kill you. But it's so rare that they don't test for it, so you just kind of hope for the best.
Yeah.
And so we're not there yet. And every cancer responds to different things, most of them, large groups of things. So it just wouldn't work with what we've got right now. We don't have one chemotherapeutic agent that would work for this.
Right.
I would imagine in the future that we may have something that we could give people that would turn on their immune system to recognize cancer as foreign and kill it.
Gotcha.
And that's the holy grail of cancer. And then it'll be over. There will be no more oncologists at that point.
Yeah. Well, don't use the word vaccine, because that'll turn.
Right, it would not be a vaccine. Thank you. Well, and we can't.
It's a treatment. It's a prophylactic.
Right, we can't have a cancer vaccine because that's what started I Am Legend.
Oh my God!
Do you remember at the beginning?
Yep.
And they used Emma Thompson, and you thought it was kind of they kind of threw you off, thinking, "Oh, Emma Thompson's in this movie. It's going to be awesome." And that was all. She invented a cancer vaccine. The next thing you know, it's zombies everywhere.
Or
whatever they were.
Yeah.
In the book, they were vampires.
Well, funny. Yeah, and Dr. Steve, I believe this is true, and this, I think this kind of coincides with that question. Is there not a way now where a lot of people who have some much more uncommon cancers, where they can send them to a lab and they can run a data analysis across a bunch of all the chemotherapies and everything to see if anything might trigger.
Yeah, there's the use of AI. They did that with COVID.
Okay.
They used AI to determine, based on the structure of the spike protein,
right,
what drugs, and also its metabolism.
Right.
But they don't really metabolize, but its life cycle. What drugs might be useful off the shelf. So we can just pull a drug off the shelf.
And it could be anything.
And, well, the interesting thing is hydroxychloroquine and azithromycin both were on that list of potential drugs. That's where some of this came from.
Sure.
And those didn't pan out like we hoped, but, yes, they can do those things.
Yeah.
And so what I find more interesting are the cases. If you go to drsteve.com and click on the link that says non-pseudoscience cancer cures, I haven't posted anything there for a long time, but there are a couple of treatments where they take cancer cells out of someone's body, treat them with some chemical to open them up so that they expose their proteins more readily to the immune system, expose the patient's own white blood cells to that, and then inject those white blood cells back in. It's kind of like giving a search and rescue dog somebody's sock and rubbing it under their nose and then saying go.
Yeah.
It's really very analogous to that.
Yeah, that's pretty cool.
And then because there have been the early studies, they do 1 or 2 patients. And one of those people is a stage 4 cervical cancer. That's a terminal illness that's now walking around, cancer-free.
Oh,
and they have now started to sell this as a commercial product for certain cancers.
Good.
So anyway.
Well, hopefully it helps somebody.
Yep. All right.
Good question.
Oh, this is a good one for Dr. Scott. This guy actually specifically asked me to ask this on the podcast so that you could weigh in because he knew what you were going to say.
Oh, no.
Oh, hi there, Dr. Steve, Dr. Scott. It's Darren in Illinois.
Darren, what's up?
As I've talked about previously with you, Dr. Steve.
Oh, my God,
I
dude.
got my calcium scan done, and it came back done over 400 this time. So my doctor referred me to a cardiologist. Well, the cardiologist just put me on Crestor. I'd like to hear y'all thoughts on this particular statin drug. Thank you kindly.
Well, thank you. He's making fun of us.
Mm-hmm.
I mean, I don't. Okay, anyway. All right. Well, I'm certified calcium treatments are.
I'd get me a shot of that Dar liquor and
Get you some little taste of corn squeezins and get you some poke salad and mix it up with some possum grease and you'll be just
down the old hatch, brother. Down the old hatch.
I like the fact that people underestimate us down here.
Mm-hmm. Yes.
And if they think we're all like that, they won't come here.
Exactly, because we really are. We none of us have any teeth, and
I know I've probably said this on the show before, but I realized how, because growing up, there was 4 miles of dirt road going to my house in North Carolina, and so I grew up it was in the not the foothills like we are here. I was in the mountains.
Right.
I lived in a valley. There was mountains all around me.
Poor valley.
And that is a valley around here.
Yes, it is.
But so I realized how inculcated into Appalachian culture I was when my wife was watching Honey Boo Boo, and Mama June was talking, and they were putting English subtitles under her. And I'm like, why are they putting English subtitles under somebody that's speaking English? I thought something was wrong. They had screwed up.
Yep.
And I went, okay, I get it. I'm a damn hick. She sounds normal to me.
I know the feeling.
Old Mama June. And I know when Bobby Kelly came down here and he heard my mother-in-law, all he could hear was dip, 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 dip. That's what it sounded like to him. He couldn't understand the things she said.
Sure. And
Big Joe.
Not real hard.
We need to get Big Joe and Bobby Kelly here in the studio together sometime. We'll just let them talk.
I don't know who I'd feel more sorry for.
Oh no, I would feel more sorry for Bob Kelly. Absolutely, that's a no-brainer. Yeah. Anyway, we'll do that sometime. We need to get old Big Joe in here. Yeah. All right. So, what do you think? Goofy accent aside. What do you think about his question?
I think
he did a calcium score, so we'll give him one of these.
Give yourself a bill.
And it came out 400.
Yeah, pretty high.
So 0, the value of the calcium score is when you score a 0. That's the real value, because that is, there's more value to that. If you get a 0 on your calcium score, it is highly unlikely you're going to have myocardial infarction, in the next 10 years.
Mm-hmm.
Now, go ahead.
Yeah, I think it's very reasonable to put him on the statins. Take him for a while.
What?
Well, no, hang on. I haven't finished. And see if you tolerate them.
Right.
Yeah, and if you tolerate them well, then it's really not a big deal. Remember, my only complaint with statins is I don't think that the
adverse effects are
no. I don't think the providers should be. I don't want to say forced, but strongly encouraged to give every single person in the United States a statin.
Yeah, no.
Because I don't think every single person needs it.
No.
But Dr. Steve, it's like I've always
if
said.
you're at high risk.
If you're at high risk, I don't think it's terrible. Now, that being said, if you take it and you tolerate it, no big deal. If you take it and you don't tolerate it well, the research shows that once a week is very, very effective.
You are on fire today.
Yep.
Where are you getting all this knowledge from?
Give yourself a bill.
And then tell them to stick it in their ass. No, but I think. Listen, we're not your doctors. They're giving you these for a reason. Try it and see how it works. Yeah. If you've got questions, let us know.
Ladies and gentlemen, hell is officially frozen over.
Yes, it is. No, I'm not saying I like it, but in this case,
I didn't.
In this
tolerate
case, it sounds like a reasonable thing.
And then I got off of it, and I tried it again. I still didn't tolerate it. I got off of it again, and then I said, "Oh, just screw it. I'll just take it." And I'm tolerating them fine now.
And like I said, there are other ways to do it. Donating blood has been shown to help lower cholesterol.
Yes, I wonder if it's been shown to decrease heart attack and stroke, though, except in people who have polycythemia. But anyway,
yeah.
Okay, no, go ahead, talk, and I'll look it up.
But with a calcium score of 400, it's pretty high. It'd be nice to get that down some.
Okay, yes.
Yeah, it is nice. And modifying a diet, exercise, et cetera. So there's a lot of other things our friend in Illinois can do. But I got to tell you, I tell you, my girlfriend, when I was in high school, they had moved down from Chicago, and her mom used to give me a bunch of bullshit about my accent.
What?
Which I said, I don't have an accent.
No, you do.
Well, I know I do. But at that time,
I have one.
At that time,
even though I got rid of it when I went through broadcast school.
Yeah. Well,
it came, it comes back.
We modify ours unless we've both been drinking. But anyway, She gave me a hillbilly book about hillbilly accents, and I read that book, and I was like, "Oh my God, this is literally how I say things."
Yeah.
So
far.
Where's that? Where y'all going? Over?
Yeah.
And it's just
y'all too. Y'all can you favor? Bar.
I love it.
Look at that bar. That ain't a place you sit and drink.
No, sometimes you eat the bar, and sometimes the bar eats you.
Yeah, exactly. Okay, so I found cardiovascular benefits of phlebotomy.
Okay. Oh, cool.
Well, this renewed interest in the age-old concept of bloodletting. Of course, Dr. Scott would think bloodletting was good, but has let me see, blood loss such as following regular donation is associated with significant reductions in key some key variables. I've never seen this word before.
What is it?
Hemorrheological variables. I think this is not one that's used in the United States.
Yeah.
Including whole blood viscosity, which, if it's less viscous, it's going to be less likely to clot, you would think. Plasma viscosity, hematocrit, and fibrinogen. Elevated whole blood viscosity appears to be a strong predictor of cardiovascular disease, an important factor in the development of atherosclerosis. So, you might be onto something there, Dr. Scott.
I think so.
Sure, you want to do whatever it's going to take. And if you physically can't take statin, which is the proven way that we know to decrease
cholesterol.
To decrease heart attack and stroke. I mean, it's 30% decrease. That's decent. Do all the other things that you can do, and if you do 3 things that reduce it by 10%, you're getting close.
Got a fighting chance.
So I did find the God, my voice changed. I'm going through puberty. Did you hear that?
Mm-hmm.
I did find the calcium score is 1 to 10. A 0 is awesome. 1 to 10, minimal evidence. 11 to 100, mild evidence. 101 to 400, moderate evidence. And then over 400 is extensive evidence of coronary artery disease. So those people are at high risk. I would treat a moderate or high risk person with a statin and other things. Obviously, you don't just take a pill and hope for the best. You got to increase your exercise. You got to get off your asses and quit smoking. And, I'll see you in 1 week for the next edition of Weird Medicine type stuff. You need to eat better. You need to, binge alcohol less, those kinds of things.
Yep.
Do all of that. I mean, I used to talk to my patients, and I would sit down, I'd write it all out. These are all things you can do. You can increase your soluble fiber. If you can't do that in your diet with oat bran and stuff like that, then just use Citracel.
Yep.
Citracel is soluble fiber. As a supplement, it may decrease your bad cholesterol by a few points. You want to increase your exercise. That'll increase your good cholesterol by a few points.
Yep.
If you decrease your bad cholesterol and increase your good cholesterol, that actually will, that gives you a pretty decent benefit. If you don't drink, then this resveratrol containing liquids like purple grape juice is okay, or a half glass or a glass of red wine a day.
Yeah, sure.
Let me see, what were some of the other things? Quitting smoking, get your blood sugar under control, those kinds of things. Those lifestyle measures, we can't just substitute those, for just taking a pill.
No.
Just like
it all works together.
The fish oil thing, eat more fish, less other stuff. Don't just render these poor fish down into a pill and take it and think you're going to do something. I did a whole podcast when you weren't here, which I wish you would go listen to, because I know you never listen to the show, but it's called Eat Your Goddamn Vegetables. And I played a YouTube video, so it was out there, of a company that's selling a dehydrated vegetable product and saying that, and I've seen the other commercials where they're like, oh, I don't want to identify it, but I have this profession and I work late into the night and it's just too hard for me to eat fruits and vegetables. Like, shut up. You can eat an apple while you're doing that.
Yes, you can. Just have to.
Are you an adult? Yeah. Then you can make this choice.
Yes, you can. Yes, you can.
I understand if you're addicted to something that it isn't as easy as saying you can make this choice, or like people say to my wife, when her depression is in full, well, you should just be happier, just make yourself happier. You can't just do that. But you can just choose to eat an apple. You can choose not to take a pill and think somehow that's going to Come on.
Easy, baby.
Come on.
It ain't that easy, baby.
I'm just done.
All right.
Anyway, all right. Listen, thanks, everybody.
Thanks, everybody, yeah.
I really appreciate you being here. Anybody else? We need to give any shout-outs to anyone in the chat room, Dr. Scott? Kim Chickens is there.
Talk like hick to you, and they're getting ready to get some big, massive storms.
Oh, no. Amy is getting hit by the storms again?
Again, yeah.
God, she just got hammered.
Yeah, they're still picking up from last time.
From them tornadoes.
So good. You guys hang loose.
What? Black by day and white by night. Beware tornadoes, said Mama D. White. That's an old country saying there, Dr. Scott.
It is.
Okay, I'll stop. Thanks always go to Dr. Scott. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Tampa Dali Museum attendee, I don't know, a blower, I guess. No.
I love
filleted her. She filleted her boyfriend, I'm sure, at some point. Roland Campo, sister of Chris. Sam Roberts, she who owns Pigs and Snakes. Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf. Christopher Watkins Double, Steve Tucci, the great Rob Bartlett. Vicks Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, producer Chris, Jenny Jingles, the inimitable Vincent Paulino, everyone. Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, G-Back and Fez Watley. who supported the show never went unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. By the way, listening on demand is the best way to do it. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. I will see you May 14th in Nashville, and we're going to eat Prince's hot chicken, and I'll buy beers. Beers are on me.
Beers.
All right, I'm at the AC Hotel. All right, see you then.